Okay, I'll get us started as people are entering the session. My name is Corinne Waldow. I'm the Senior Director for Economic Vitality at the Boulder Chamber, and I want to thank you for joining us for this week's Public Health Update. It is the normal cross-industry update session, but it's been merged with this week's Boulder Economic Summit put on by the Boulder Chamber and the Public Health Update that we're doing within that program. So we're going to add to it a little bit this week and give you a little bit more updates on numbers, where we are in the dial, where we are as a community, and make sure that we understand where you need to be within your industries as we enter into the winter months. Jesse, if you want to move on to the next slide. So I want to give you a little bit of background though. I want to show the power of partnership. These sessions have been going on for months. Since April 30th, we've had over 115 webinars. That's a lot. And I think we joke about it, but it's been a great partnership between Boulder County Public Health, the Boulder Chamber, and the Latino Chamber to help make sure our business community is updated on the information they need to navigate this very uncertain world and the ever-changing rules that you have to follow to make sure that you're opening in a safe manner. This is all about making sure that we're opening for our health and for our economy. Within those 115 webinars, we've had over 3,850 registrants, and then we've recorded all of these. And believe me, we've had over 4,500 video replays. I feel like I'm a talk show host sometimes, but I think it's a great sign that our community cares about knowing what we need to do to safely reopen. And up until recently, our numbers showed it. We showed that our businesses truly cared about the really important measures they needed to do to safely reopen. And they continue to work daily, very hard to follow those public health orders. And we're going to continue to follow them into the future so that we as a community do what's best for our health and our economy. So at this time, I want to pass it on to our partners in this partnership that we've had since April 30th, Boulder County Public Health. And I want to thank them for continuing to answer your questions, to being on these webinars, and to playing a role in this great endeavor that we've had. Because it hasn't been easy. And we know it hasn't been easy on businesses, but it hasn't been easy to kind of really navigate this. So I want to thank Jesse, and I want to thank Lane, and I want to thank the 25 other people at Boulder County Public Health who have helped out along the way. So Jesse, why don't you take it from here? That's all the slides I'm going to give from the summit side. We can go back to your normal slides. But I really wanted the business community to understand the power of the partnership that we've had up to this point.
Absolutely. Thank you, Corinne. And yeah, it's been a great pleasure to work with you and the Chamber to try to get our message out there and try to support the business community as they were given the opportunity to open up, and hopefully we have more opportunity to open up more. So I'll just jump right into it. The agenda for today, I'll do a pretty deep dive into the epidemiological data. Then I'm going to talk about the state dial framework, the Boulder County Public Health orders, and then we'll go into a section on reminders about sector-specific information. So let's go ahead. So really, the epidemiological data tries to get at what's going on with COVID-19 in our community and across our state. And this is a chart that shows our 5-day running average of COVID-19 cases, new COVID-19 cases in Boulder County. And as you can see from this, you know, we had spikes in April, we had spikes in June, and for each of those, we sort of ramped up our response. And then at the beginning of September, we had a really big spike. And luckily, through a combination of public health orders and cooperation from our community, we've actually had great success bringing those numbers down. I think this talk shows a lot about how the community came together to address both the most recent spike and then previous spikes as well. So a little bit more about that. The most recent spike was mostly in our 18 to 22-year-old age group. And so for that period, we tracked, sort of separated out by age, what was happening with positivity. And as you can see, the vast majority of that spike was in the 18 to 22-year-old age group. However, since then, and from that spike, we did see increased positivity in all of our age groups. Now, it does look like that's flattening out, and that's great news. But it goes to show how important it is that everyone in the community be working together, and how interconnected we are. So just wanted to show that for a little bit of context. And then, I think this is sort of my one statewide graphic, and I think it's an important message that we need to be thinking about as we go through the rest of these slides, and that is the reproductive number for this virus. That's the number of people that are infected by a single infected person. When it's below 1, that means the number of infections is going down. When it's above 1, that means more than one person per infection could happen. And as you can see, we're seeing that reproductive number peak up over 1 again, and there are concerns that that number is going to get even higher. So, this is the time when we need to start thinking about our behaviors and how do we affect this at the community level. But that's the statewide, a little bit of statewide context, and I think it's really important to note outside of these charts that in the news we are seeing increased cases across the country, and as we go inside, that just puts us all closer together indoors. So really be thinking about all of the ways that we can protect ourselves and our community. So this is a lot, key takeaways, lots of key takeaways from this information, but really I think the important thing is geographic differences. In previous presentations, I've talked a lot about how the spike was happening a lot in the city of Boulder, and so we were seeing a differentiation there. Well, unfortunately now we're seeing that echo out into the community, and we're seeing higher case counts in some of our other communities. And so it does seem to spread through the community step by step, I guess. We're still seeing racial and ethnic disparities, and that's a continuing concern for us about messaging out to the right groups and trying to craft the message so that people understand the importance of this. The trends among 18 to 22-year-olds, as I mentioned, we're seeing that going down, and they were the highest we've seen for any age group, but they have actually sort of rejoined the rest of our age group, so that's a good thing. In terms of testing and positivity, we did see a spike in positivity rates associated with that spike in 18 to 22-year-olds, but that's now down almost to 2% across the population. So that's a really big deal for the community. Interestingly enough, we have seen an uptick in mortality, which is a concern and something that we're continuing to track closely. And then we are seeing outbreaks in various, in school settings and things like that. And our teams are working really closely with the schools, working really closely with classrooms to try and address this. And I think it's, it's another example of the community pulling together to try and address this. But we are seeing these limited outbreaks that we're trying to address. So that's sort of the epidemiological update. In terms of the state dial framework, I'm going to go over what the dial is, what does it mean for the community, where are we as a community, and then what happens as we go forward under this dial framework. We are currently at safer at home level 2, and this is the fabled dial and each county has to is somewhere on this dial, and that is based on these three metrics that are put forward by the state. And where you fall in these three metrics defines where you go on the chart. If you, so for example, we are now down to 124 cases per 100,000. That puts us in level 2. Our percent positivity is 2.4 overall for the last 2 weeks, and that puts us in safer at home level 1. And then we have we've had decreasing hospitalization for a number of days, and that's a good sign too. That puts us in level 1. And to move between levels, you have to actually be in that level in all three metrics. And we look at that every 2 weeks, and we make a determination. And to fall back down a level, and I'll get into this in a little bit of detail later, but you consult with the state if you start to see your metrics going lower on the dial. But what does moving up and down the dial mean? There's been a lot of discussion about this, and to try to make this a little less confusing, I took out protect our neighbors and stay at home, mostly because I wanted to focus on where we are and where we're going to be able to get to soon. But the important thing here is that safer at home, the dial really just impacts the capacity of spaces. It does not impact the things that we do in our businesses to maintain the guidance that's set by the state. The public health order guidance is the same: wearing masks, washing, cleaning spaces, all those sorts of things. Those all remain the same regardless of what level you're at. The difference is how many people can be in your business at every different level. And so, for example, for personal gatherings, right now we're at safer at home level 2. That's 10 people. Under level 1, if we were able to go there and maintain that level, we could have up to 25-person personal gatherings. Another example, again, what's a good, generally you're talking about, so for indoor and outdoor events, this is a big one for a lot of our houses of worship, for example. Under safer at home level 2, indoor, you're allowed to have 100 people at the largest size of facility, over 7,200 square feet. Under level 1, they could go up to 175 people per room, larger than 7,200 square feet. So these are the sorts of things that would change as we move up and down the dial. But I think it's really important, again, to note that we are not going to be changing practices, it's just capacity. So where are we on this? We talked about we're at level 2. Let's look at the statewide information. We're in that sort of yellowish color. The metro area is a mix of mostly level 2 and level 3. And there is Gilpin County, very small county, was able to go to protect our neighbor, but the majority of the metro area is in that level 2, level 1 setting. Again, our positivity rate, I'm sorry, I think I may have said 2.4 before. It is now 2.7, the 2-week running average for positivity. So that puts us in a really good place. Again, most of the metro area is in that category. And then, up until now, we've seen decreasing or stable hospitalizations across the entire state. Again, that changes. There has been news about increasing case counts that can lead directly to increased hospitalization. So that's something to watch out for. So moving on to how we move on the dial. If we're moving up the dial, if our metrics allow, every 2 weeks we review and we have to inform the state of our plan to move up the dial. If unfortunately our figures are looking not great and we have to move down the dial, what we do is the state reaches out to us and says, you have 2 weeks. What's your plan for addressing this. And we actually went through this, and I'll talk about what we did to address this in a moment. But we had, because of that spike, we had significant cases per 100,000, up above 400 cases per 100,000. And so we came up with a plan, we being public health, that the state approved to try and address that. And really what it is you create a mitigation plan, and if that plan succeeds, you can move back to your previous level. So that's generally how that works. As I mentioned, we fell below level 2 early in October. We instituted that mitigation plan that was about 25 measures, including our targeted public health order. And that has allowed us to stay in level 2 as a community going forward. And we're seeing those numbers get better and better. So it is really important to act as a community, to recognize where we're having problems and try and address those issues. So one of the questions we get a lot is, what are the chances that we'll ever move to level 1 or even protect our neighbors? And we need to be able to maintain a level for 2 weeks to be able to move to there. And then we need to stay at that level, because if we were able to achieve level 1 numbers for 2 weeks, get to level 1 and then immediately fall back down, there's not really any purpose to that. So what does it mean to be able to move between those two levels, to move up in levels? And also we need to think about, what does it mean to move indoors? And then with the holidays coming, what does that mean? And one of my colleagues helpfully created this chart that I think is really illustrative of where we are and what it means to move between levels. So this is not, the dial was only instituted recently, so this is not how it has worked. But if you look at our numbers and you overlay that over the stay-at-home levels just for cases per 100,000, you see that we were only in, we're only in level 1 every once in a while for a little bit. And so I think what this means to me, and what I wanted to communicate to all of you, is it takes a concerted effort to get to level 1. This is not something where if numbers are good for a little while, we can move up there and then bounce back to level 2. That's not the kind of certainty that would allow you to operate a business safely. So, that's the sort of thing that we need to keep in our mind as we look at these charts. In terms of our mitigation plan, I mentioned it before, we instituted a mitigation plan. There were 25 items on it. Most of them were what we were already doing. But one of the things that did change was we looked at instituting a public health order for 18 to 22-year-olds. We instituted the public health order. We put it in place for 14 days was what it was originally set up to do. And what it did was it limited gatherings for 18 to 22-year-olds. At the time, we said gatherings of 1, although that changed to 2 pretty quickly, were permitted for 18 to 22-year-olds. Any more than that was not allowed. That allowed people to go to work, to get food, get supplies, all those sorts of things that you would normally need to do. We're trying to limit gathering. And to that end, we had 38 properties that went into stay-at-home, and that meant that those groups of people could not go out except to exercise and to get medical care. They could get food and things like that delivered. And what we were trying to do was encourage continued testing and symptom checking by CU students, just to try and get that spike amongst 18 to 22-year-olds under control. So then how was that updated recently? So this week we updated the public health order, last week we updated the public health order. And we now have a situation where young adults, 18 to 22 years old, have more opportunities to gather under essentially something like the dial. and I'll show you the chart in a moment. And then any of those stay-at-home properties, they could apply to be removed from the stay-at-home order by presenting a plan to us that explained how they were going to maintain their responsibility for their residents and reduce the chances of gatherings so that transmission was less likely to occur. So those two parts, I think, are the big parts that changed, that are showing that we have faith in our 18 to 22-year-old community to behave and try to get them out back into the community. So, like I said, we tried to come up with something sort of like the dial, and these are the metrics that we were looking at. We created this, the various levels, and the cases per 100,000 and the positivity rate, and so we've seen actually really good results over that time. We've been able to get case count. They as a group have had lower case counts. They're getting consistent testing, and they are following their testing requests from CU. So that's a really good sign. And as a result, yesterday, we released that they now can go to 6 people, gatherings of 6 people, as opposed to what it was at the beginning of the week, which was 2 people. So a pretty significant change. And also the other thing that we're really encouraging is CU can organize events for CU students in larger groups. But I think that's another way for the community to get together. We are trying to show that we have faith in them as a community to respond to this in a positive way. So that's all the public health order information. That's where we are in the dial. That's where we are in our local public health orders. Now I want to transition to reminders. We're going to go through the facial covering order. We're going to talk about sector-specific information. So this may be a little bit of review for some folks, might be new information for others, but I want to sort of give you an overview so that we can get to any questions sooner. So the facial coverings order, the state order is still in effect, and facial coverings are required in all public indoor spaces and for all people ages 11 and older. I put this mask required to enter sign up because that's actually something that is required of all businesses. You do need to have a sign on your front door that reminds your patrons that masks are required to enter. Within Boulder County, we have an additional sort of a layer on top of the state order that says that facial coverings are required outdoors whenever 6 feet of social distancing cannot be maintained. As an added confusion, each municipality has the opportunity to create a mask order that can be stricter than both Boulder counties and the states. And so I encourage you, if your business is located in any, in Louisville, Lafayette, I believe Superior had one for a while, or they may have dropped theirs to be in compliance with Boulder County, but check your local community to make sure that you are in compliance with their mask order. So I'm going to jump into sector-specific guidance. Just remember, use the dial, check your capacity. I'm not going to bring up each capacity, but remember we're at Safer at Home level 2. Other overall guidance, keep your spaces clean more regularly than you ever have before. A number of sectors have very specific guidance about cleaning, like cleaning between each customer. Be sure you're aware of that and following that protocol. Monitor your employees for symptoms. That's checking their temperature. That's asking them each day, do you have any of the symptoms of COVID-19? That way you can catch an outbreak or a single sick employee before it affects your entire business. And then the last thing, and it's really important, And I'm now kicking myself for not including a slide with the 3 basic things that you should do, but enforcing the mask order is really important for both employees and your customers. Wearing masks, washing our hands, and maintaining social distance are the 3 things that each of us as individuals can do. And you all have a unique position as business owners and managers to really look at, okay, how do I do this at the business scale? So just really want to reinforce those that mask order and the hand washing and social distancing. So now jumping into specific sectors. In terms of events, the state divides those into indoor and outdoor events. Indoors, you have a maximum of 100 people allowed. If your space is large enough, you have to be a large enough space. And so definitely check the regulations on that. For outdoor events, your maximum is 175. So please check the regulations if you're getting anywhere near those caps. It's really important that you be very careful about that. And I want to sort of drill down on the indoor maximum. It's actually 50 for most indoor spaces. There are only very few exceptions where you can go up to 100. So please be in touch if you have questions about that. Other event issues. Food service has to follow all food service guidance from the state. That means making sure that you are in compliance with both state level food guidance, but also the COVID-19 food service guidance, which I'll get into in a little bit. And then the thing that's come up a lot, performers, they must be 25 feet from any audience. That can be reduced to 6 feet if there's no singing, speaking, instrument playing, or heavy breathing as part of that performance. So just be aware of that. That's what the asterisk at the end of that is. The 6 feet rule if there's no heavy breathing or instruments or singing. All right, moving on from there. Non-critical manufacturing and really manufacturing in general. All employees need to be wearing masks. You need to do social distancing. Breaking up shifts is a way to do that. One of the things that they encourage in the guidance is the need to create impermeable barriers between workspaces. That will allow you, your employees, to work a little bit more safely in the face of indoor spaces and the spread of the virus indoors. For office-based businesses, this is a question we've been getting a lot. All employees must wear masks at all times, unless they are in a room with 4 walls and a door and they are alone. If you are sitting at a desk, you still need to be wearing a mask if the desk is in a room with anybody else. And so that's why we encourage people to wear masks at all times, because who knows if someone's going to walk into your office. So that's on top of your customers wearing masks. All your employees need to be wearing masks all the time. A cubicle is not an office with 4 walls and a door. That is, a thing that keeps coming up. For restaurant and food service, there are a lot of guidelines for restaurant and food service. And I didn't want to go into all of them in detail. One of the things that we get a lot of questions about is table spacing. For tables, they must be spaced such that when people pull their chairs back to get up, they're still 6 feet apart. And then you also need to do symptom screening for all your employees. Another thing about restaurants and food service that I want to point out is there are a lot of indoor and outdoor rules to be aware of, especially as we go into the winter season. Check with your municipality or the community you're located in for their rules regarding continued outdoor space use. A lot of restaurants have been able to move out onto the sidewalk. We want that to be able to continue, but you need to check with your community to make sure that that's permitted. In addition, check the regulations. There's information in there about what constitutes a tent or what makes a tent an indoor space. And it has to do with number of walls, and it is complicated, and it is worth reading about. Bars. Bars are only to be open if they have a food license or a partnership with a food licensed food purveyor. And I think it's probably not news to anyone except for me, but last call in Boulder, according to Corinne and some other things I've read, has been extended. So that's good. But it bears watching because that is a tool that the community can use there to address groups of people gathering. All right, moving on. Retail. Retail really, overall, wear masks, keep your capacities at 50% of your capacity. But I think other than that, cleaning returned objects and cleaning high touch surfaces really will help make your space safe for customers. In terms of personal service and limited healthcare, this is my area of expertise since April, so I hope I'm going to get all this stuff right. But I think, you know, the guidance really says to continue to provide service by appointment only, no walk-ins. And the big difference for limited healthcare providers and personal service providers, both have to wear masks at all times while they're in their business. But limited healthcare providers need to be wearing a medical grade mask. That's just a surgical mask, whereas personal service industry providers can wear a cloth mask. And then another point that I think has come up a lot, there was a change in the summer that allowed for people to provide service to customers in places where they would need to remove their mask. That does not mean that the service provider can wear a mask, and in fact, the service provider needs to wear a mask and a face shield when providing services during which the customer will remove their mask. So just some details there. Moving on to gyms, fitness centers, and group sports. For gyms, your indoor capacity is 25% of your capacity or 50 people, whichever is fewer. And everyone must wear a mask while working out. In terms of group sports, on a field, you may have 25 players max. Limiting spectators and requiring social distancing if they're present. They also need to be wearing masks if they're present. And your spectator numbers are limited by indoor and outdoor event guidance. So check that number. That's an ongoing question that we've received. Some indoor spaces have started to allow spectators back. Really make sure that you're keeping those numbers in accordance with the indoor event guidance. Places of worship, and this is where that 100 patrons thing comes in. So I think worth paying attention. So indoor, they're allowed up to 50 people. If you have a space greater than 7,200 square feet, you can have up to 100 people in that space. One of the things that we've seen houses of worship do is open up accessory rooms to have more people, and that is totally fine. The numbers here for indoor maximums are for per room. For outdoor, you can have up to 175 people in an event. Again, those need to be socially distanced. People need to be wearing masks. If they're going to be anywhere near each other, just be very cautious about that. Those larger number events. And then finally, choirs should not be used. That's a recommendation in the guidance, but I think it's really important to note that transmission is through aerosols, and singing, speaking, all those sorts of things really can increase transmission. And when you project, your aerosols go much further. So with that, these are our sources of information that I pulled this stuff from. COVID19.colorado.gov is a hugely helpful website. It breaks the guidance down by sector. It also provides access to the original language from the public health orders, worth looking at if you're trying to understand where these come from. For county information about the dial, information about our local public health order, that's a link to our website, and Corinne shares these links in her emails at the end of this, so you don't need to click on things here. Our dial status is also on our webpage, and it is actually a graphic that moves, although we've never moved off Safer at Home Level 2, so it's never had to move. And then our local public health order status is also there, as I said. I'm going to just leave you with sort of 3 thoughts that I think are really important. With winter coming, we're going to be indoors, and that means putting people who don't live in the same household in spaces together. It means, closed doors, closed windows that are going to impact transmission. The holidays are coming up, so people are going to be traveling possibly. People are going to be visiting with friends more. So just really want to remind people of those 3 things: washing hands, wearing masks, social distancing, and also limiting those gatherings. Really, that's the best way to stop transmission. And then just really, we have to do this together. As you saw from that chart where my colleague put the our new cases up against sort of our different levels, we need to work together to get, if we're ever expecting to move to level 1 and stay there. So it is about cooperation and community action. So with that, please come back next week. We'll have a general update, and we may have a special session scheduled for next week. We have not set a subject yet. And our Spanish language session, which my colleague records and releases on Thursdays, will be shorter than this. So if you want a shortened version of this, she does an amazing job, and we really appreciate the support of the Latino Chamber with that. With that, happy to take questions. Please, if you have complaints or questions, email us. If you have complaints or concerns, you may call our call center, and they are a great team who will try and direct you the right way to get your answers. With that, happy to take questions.
Great, thank you, Jesse. And even though this was part of the summit, this is an ongoing session that we do a little shorter. We do every Wednesday at 3 o'clock. And then if there is something like, we did a places of worship session, or we did a gym session at 4 o'clock on Wednesdays, if there needs to be an industry specific, deep dive, we do plan those out. If you do register for one of these sessions and there's an update that comes out, just for example, the new last call change that happened in the city of Boulder today, you'll get an update from me on any of those changes that happen in the public health orders. So that's a good part about being part of these sessions, is that we try to keep you as updated as possible. Don't always capture everything right away, but we try to keep you up to date. We've had quite a few questions come in, so I'm gonna get through. Some of them are specific, some of them are more general. So we've heard the governor talk about rising cases statewide, and there's this general fear of rise in the surge. And you talked a little bit about what we can do, but what can business owners in the area do to themselves? What can they do to help the current surge in cases statewide? I know we feel a little out of control. What can they do to help in this situation?
Absolutely, it's a great question. The easy ones are the washing hands, wearing masks, socially distanced. Encourage that amongst your employees. One thing that I know makes people uncomfortable is talking to customers who come in and refuse for whatever reason to wear a mask. Increasing positive communication about wearing masks is really helpful. The county put out a mask script that I didn't link to here, but is on our website. We try to walk through a conversation to try and get people to the point where they'll wear a mask to come into your business, or take advantage of other services, online ordering, curbside pickup, that sort of thing. In terms of what businesses can do, I think signage, I think again, encouraging employees, and one thing that is sort of after the fact, but I think actually is very important, having been involved in a couple of these conversations, is if you have a sick employee, if you have an outbreak, sharing that information, we're aware of it and we will be in touch with you, but sharing it with your employees, making sure they're aware of the situation and that you're in contact with Boulder County and that you're working on that is going to reduce concerns and allow you to stay open. And we work closely with businesses who are impacted by an outbreak or a single sick employee in the same way that we will work closely with those sick individuals to try and help them get the services they need to be safe. So I think that's a sort of after the fact thing, but very important.
And that leads to a question we have, and we do have some new people on the call. An outbreak is technically 2 or more employees at a singular site, but what if you have 1 or you suspect 1 or someone was exposed? Should you still contact Boulder County Public Health? And how do you contact?
Yeah, that's great questions. So if you have, and it's sort of different answers. If you have a single sick employee, that employee is going to get contacted. So public health, the testing sites share that information with public health. If they get a positive test, they contact us and say, hey, this person tested positive. Our team, super awesome professionals, contact that person, try and figure out where they work, where they've been, all those sorts of things. And then we, as the business liaison team, we reach out to the business and say, hey, just so you know, we received word that you have a sick employee. Here are the protocols. And actually the protocols are available on that covid19.colorado.gov website. It's kind of hard to find. If you go there and you look up, what if I have a sick employee? That information is sort of halfway down a page, but it is there. We can talk about that in detail if you want, but I think the important thing is we will know if you have and then the second part of the question, if you have a probable or if you have someone who's concerned or someone who had contact, it's really important that those people who are concerned be given the opportunity to quarantine for 14 days to make sure that they do not have symptoms. That's the safest way to make sure you give it the full incubation period. They check their symptoms every day by themselves. They make sure they're not sick. And there are programs through the state to protect that employee's job. So reach out to the state if you have questions about that. If you do have questions about the process, if you have an employee who's concerned or you hear about a possible contact with someone, you can call the COVID-19 line, you can email us, and we'll direct you to the right people to speak to.
And one negative test, if that person was exposed or had exposure, even if they're asymptomatic, a single negative test doesn't necessarily mean they don't have it. That's why you need the 14-day quarantine, because it could take up to 14 days for them to test positive for the virus.
Absolutely. That's a really good point. And testing only tells you if you're negative at the point of testing. You can get sick the next day. So that's a really good point.
And there's a difference, and I know there's a lot of terminology issues out there. There's a difference between quarantine and isolation. Quarantine is what you do when you are exposed. Isolation is what you do when you have the virus.
Yes, absolutely.
So we have a couple questions about masks, and one of them is, can you replace a mask with a face shield, especially since masks are hard to wear when you're wearing safety glasses?
No, unfortunately not. A face shield is not does not close off the face enough. It doesn't stop the spread of the aerosols in the same way that a mask does. So you can wear them together. There are definitely, I think there are videos I've seen. I would definitely do an internet search about the safety goggle mask conundrum. I've noticed that running. There are times when I'm running in a fog because I fogged up my glasses.
I actually got Rain-X for my glasses. It's like a Rain-X. My son his sports goggles would fog up, and so I put that on there, and that's what I actually did for my glasses and my mask, because they'd fog up. So it's very similar. You can find it on an Amazon, or a local retailer also sells those things as well. But the point is that you cannot substitute a face shield for a mask, but you can wear them both, but you cannot substitute them.
Right. Absolutely.
Okay. So we need some more clarification on whether what's considered an exposure. So to define an exposure, would being exposed to the husband of someone that's potentially positive be considered an exposure?
It's hard to answer a hypothetical, I feel like. But I think the way the state defines an exposure is really helpful and may get at this question. So they say if you had 15 minutes of less than 6 foot away exposure to someone who is probable or tested positive for 15 minutes, and that 15 minutes can be over an extended period of time. You can sit with them for 2 minutes and then go away and come back for 10 minutes. And if it's 15 minutes total with that one person up close and personal, then you are considered exposed. And that is a pretty strict definition. So just be aware that 15 minutes, because the initial statement was, if you're close to someone for 15 minutes who then tests positive, you are a possible exposure. But then they clarified that that 15 minutes can happen over a day, essentially.
Thank you, Jesse.
Yeah.
I know we sometimes get these hypothetical and sometimes they're very specific, but I think, clarifying and defining on these calls will sometimes, help jog people into what it is we're trying to say.
Absolutely.
Some more defining questions. So you say an office is 4 walls and a door. Does that door have to be closed?
Yes. Thank you for that. Yes, your door has to be closed. If you are in an office alone with your door closed, you can take your mask off. But again, I really recommend that you keep that mask on because you don't know who's coming through that door. But if the door is open, you are part of the larger room and you are no longer permitted to have your mask off.
And we get this question all the time, that cubicle question. Even if you have a barrier, it doesn't go to the ceiling. So yep. It's not a door. And the other question we get from offices are, do I need to put that mask sign on the front? I'm on my door. I'm not a retailer. I'm not a restaurant. Do I need to put that mask required to enter
yes.
sign on my door?
If you have the public coming in, you need to have it on. And
the public
is your
means
employees too. Yes, everybody.
Everybody.
So
okay.
This is an interesting, I maybe this is a bit of a digression, but there was a lot of question about what a public indoor space is. And the answer is a public indoor space is anything but your house or a dorm room or a hotel room. That's it. So public indoor spaces are everything.
And luckily, one of the things that the chamber did early on was we created a bunch of signs, and the state has that sign as well. And one of the links that we will send out again is the link to signage that you can use, especially signage in your bathrooms and your hallways. Don't convene in groups. Wash your hands. Wash the surfaces. Wear a mask. If you're sick, do not enter. We created a lot of that signage early on so that you wouldn't have to do it yourself. It's already there for you. There's no branding on it. It's available to you for you to use. So you talked about a little bit about the decrease in the positivity rate. Does that mean that we've decreased the testing? Does that just mean the testing has gone down, or it just means that less people being tested are getting have the disease?
Quite the opposite, thankfully. We actually really increased testing right around the time we were seeing that spike, and that number of tests has continued to stay pretty consistent. And the beauty of that percentage is it's just related to, it's not related to how many tests you're giving. Now, one thing that has come up in the past is as you do increase testing, you are going to see more positive tests. You just test more people, the virus is out there. You're going to find more positive people. But as you increase tests, your percentage is your way of correcting for that increase in number of tests.
And speaking of tests, the free site that's located at the ball field is open for one more week up until the 18th, correct?
Yeah. Mm-hmm.
Okay. But then there's also on the Boulder County site, there's links to both other testing sites as well as links to sites within Colorado that you can go to as well.
Yes, definitely.
Okay, we have a question. You say there's increase in cases. Can you please talk about how many and what age groups? Maybe you could go back to that chart that
Yeah, I mean,
shows the age groups. And whether that's, whether you talked a little bit about how that you've seen that a little bit in some of the other cities, not just in Boulder.
yeah. So I
And
think, yeah, sorry, go ahead.
and this is like a 5-part question, so I'm just gonna summarize it for you. Can you kind of talk a little bit about maybe what you attribute this to, and what you foresee happening, as we move forward in the next 30 days?
Well, I'll start there and just say I don't know. I'm not a public health expert. I'm also not a COVID-19 expert in any way. I look at the numbers and I try and communicate that out to you all, and I rely on our scientists and our data managers to try and really understand what's happening. We have really good public health folks who do this for a living, and I'm so happy they're doing it. But yes, we are seeing an increase in cases, sort of just generally across the state. It's happening across the United States. It's happening around the world, and I think personally, I think it has a lot to do with the fact that we're going inside. It also has probably to do with a little bit of fatigue with the mask orders and the public health orders and the limitations on our normal activities. And so that's why we do these sessions to remind everyone that we're still in the middle of this, and you're seeing communities that have done amazing work to require masks, to do all that kind of stuff. They take their foot off the gas a little bit and they see increase in cases. And this chart sort of addresses another part of the question, which was, so we saw that spike in 18 to 22 year olds. And at the time we were like, oh, it's 18 to 22 year olds. And then there's sort of this echo increase in all of the other age groups. And if you actually look at this chart here, you can see that in some ways, the 18 to 22 year old increase was just masking other increases. We saw sort of an increase in all of them at around the same time. And that's so many things, but we hadn't moved a level or anything like that. So I don't know exactly what caused it. I think the important thing is to focus on the behaviors that reduce it, and that is minimizing your gatherings, sticking with, washing your hands, wearing a mask. It's the same things we've been saying since the very beginning. And I think, yeah, like I said, I think a lot of it had to do with just people are tired of wearing masks, and we sort of, devolved to our normal behaviors, even though nothing has changed in terms of the virulence of the virus.
Well, and I talked about this last week a little bit about how we'd heard a little bit of COVID fatigue. I get a lot of questions. Do I still need to do this? Do I still need to do this? Am I still quarantining my clothes after returns? Am I still having to clean my products when they come back? Do I still need to do single flow of traffic? Do I still need to ask my employees to do health checks? And the answer to all that's yes. And that's a little bit of that fatigue. And then, but with the winter months, us moving back inside, that's why I asked you to do a couple of reminders on some of those hot questions that we're getting, because the reminder is, yes, none of that stuff has changed. What's changing on the dial is sometimes the capacity limits. And we don't want to increase our capacities if we're lessening some of those, because we don't want to increase any or surge in any of our numbers and then thus go back into stay at home in any way.
Yep.
So speaking of retail and the quarantining of products, have we defined a method that allows apparel retailers to restrict return policy to only items that can be properly sanitized prior to reselling?
There's nothing in the public health order regarding that. So no, I guess the answer is no. Just restricting it to the public health order. We're just asking, and I would definitely look at your industry if you have a trade group or something like that that has some best practices, that might be a place to look for information about that.
And there's a guidance on the sanitizing of items. I know the hardest items are definitely the soft goods. Those have always been the hardest items, and there haven't been many changes to any of those guidances on the website. Can you tell if there's any rules that are different for essential businesses and employees? Has that term essential really come into play?
In terms of what the rules are for wearing masks and social distancing, there is no difference. It basically, I think there was a period, I know there was a period early on where there were manufacturers who were manufacturing essential goods who needed to be in spaces that maybe didn't meet all of the requirements. So they were given sort of some leeway on that, or they needed more employees in a space. So they were given leeway on that. But now that's no longer true. And I think other functions that are necessary, I mean, an example is government functions. They're all functioning at you have to wear a mask. We had a conversation with road crews who were like, it's really hard to wear a mask and our safety equipment, but they couldn't pinpoint how the safety equipment made the mask impossible. So we told them they had to wear their masks if they were unable to maintain 6 feet of social distancing. So just an example of a critical service that's following the guidance for every business. So no, there is no difference.
The only area that still is differentiated in the order are critical manufacturing and non-critical manufacturing. The only reason it's done that is for capacity reasons,
Yep.
correct?
Yes. Yep. And one other area that I guess I should point out is emergency services and law enforcement have some flexibility on mask wearing when they are responding to an emergency.
And I will say, based on what happened with stay-at-home orders, I think that something that every business should know is whether they fall under essential business status for future emergencies.
Yeah.
But that is just for future business continuity planning in general. But as far as orders go, the only differentiation that happens, there's no essential retailers versus non-essential retailers anymore. It's retailers.
Yep.
All right, clarification on that exposure. Is it 15 minutes with a person who is without a mask, or 15 minutes with a person who's with a mask? Or is it just 15 minutes with a person who has COVID?
It's 15 minutes with a person who has COVID. The guidance does not differentiate between wearing a mask and not wearing a mask in that situation. So I think that the distance is the important thing. If you're, that's why we encourage things like, and this is something that actually we were encouraging with those essential retailers back when that was a thing, in your break room, make sure that people are not sitting right next to each other, because that's a way, if you can socially distance, even though you're there for your lunch break, that protects you. That gives you some protection.
So kid therapy, it's a child therapy location. As schools continue to return to in-person learning, is there anything more we should do or could be doing to keep everyone safe? We have been following all the public health guidance. However, there's concern as more kids are going to school and there's increased socialization, and that they'll miss the asymptomatic cases and unknowingly spread COVID-19.
So I think that's obviously a concern, and I totally understand it. In terms of guidance there, the state has not released anything specifically about that. I think the important thing to do is do symptom checks when you're for a therapist, or for a therapist, you fall under probably limited healthcare, in which case you should be doing symptom checks of all your employees as they come in. So you do need to be doing that, and that's a way to protect both your employees, your staff, and those kids. And I think another important thing is that the schools are doing their best to protect the kids as well. Each of the school districts has had to have a plan, and they're sticking with that plan, and they're monitoring their case counts and all that kind of stuff. So we are trying to address that as it happens. But I think at this stage, being aware if the student you're talking with is in a school or in a classroom that might have had an outbreak is really important. But other than that, so communication with your patients is good, but symptom checks, that's probably your best.
Well, and a reminder this time of year, if people are sick, maybe going back to that, therapy online, therapy online, or don't show up if you're sick, even if it's not COVID. We make sure that we stay home. This person also said, how do you know about outbreaks?
Definitely. So when we receive information about an outbreak, the press receives that too, and so check the press. That's often we find out about the same time they do. So that's one way to get that information. And I think also just speaking with your students, they'll know, or sorry, not your students, your patients or your patients' parents, depending on their age, to make sure that those kids are coming from, a place where you feel comfortable treating them in person.
And I actually, in the links I sent out a link to the state outbreak site, but also St. Vrain has started to put out a link to their stats. And I know that I've heard that they're also your Boulder County Public Health is working with BBSD to do a similar stats by school kind of page as well. So that's kind of I think that, you guys, you can check the CDPHE website on outbreaks, for different locations. Whoa, we just had like 10 more questions come in. Let's see. In regards to the uptick in deaths recently, are these cases very sick, hospitalized incidences? Were they ventilator patients? Was it just were they patients that were already hospitalized, or were these recent hospitalizations?
I don't know the answer to that question. I can check my notes here to see if I have any background. Lane, do you have any background on that?
We usually don't give a lot of information about deaths, especially when there's a lower number. They were in older demographic. I think some associated with long-term care facilities, but yeah, any death is still a concern to us.
Yeah.
And can you stay on this chart real quick? We had a comment that this is hard to read.
Yes.
So I will say that Lane put into the chat a link to the more detailed data page that has a lot more data for people to look at. It's all the data that Boulder County puts out. And it will go into detail some of the other data that people might be looking at. Some of the city data, that CU data, the incidence, the positivity rate data, and it is a link that we put out. So yes, it is a little hard to look at.
Absolutely.
But I think what you were trying to show was that an increase in all of the age groups, and not trying to be able to pinpoint one particular area.
I think that's really important, especially in these busy charts. What we're trying to show exactly is trends. And it's not, we are one community, and that's something that came up a lot with the 18 to 22-year-old. Why are you singling them out? Because we're trying to protect the whole community. So we're acting as one community here. I think it's important to note.
And the city-based data that is on that link that you have, it's very limited, and it's your epidemiological staff and your data staff are working around the clock to just be able to keep up with the data that you're providing. So because a lot of what you're trying to do is do a lot of the tracing and keep up with what you need to keep up with in order to meet the state demands. So you're not able to break a lot of this stuff down by Lafayette, Superior, and so forth.
Right.
So realizing that this is Boulder County data, and that may be the minutia by which we were able to provide it.
There is, and I don't know, you know, you're right. It does update more slowly, but there is a chart that breaks down total number of positive tests over the entire period by municipality, but it does lag a little bit, and you're absolutely right. There's a lot of information required that we're keeping track of, but also that information has shifted over time. So also trying to keep up with the requirements has
we have a request to have this data by municipality, and I think that would be a little that's not currently available, and I think that's one that at this point is not something that would be available to be offered. All right, I'm gonna do a last request for questions. While we're doing that, I'm gonna do a reminder that Halloween is on a Saturday this year, a full moon Saturday, second full moon of the month. And I know we're excited that Halloween was on a Saturday, you know, parties but what should we remember about this year and Halloween and just the fact that we're still in a crisis and we're still in a public health crisis?
Absolutely, great question, and I would have included more about that, but I felt like 40 slides was.
Yeah, you know, you kept in love, but I thought I'd end on a
I
boo
yes.
moment.
So the state did release guidance, and I think to boil that down to the essential things is, you know, if you are going to trick or treat, please limit it to a community. Only go to places that you know the people are taking precautions to make sure that they're not touching the candy, all that kind of stuff, that it's individually wrapped candy, same sort of safety things that you would normally do for Halloween, but just limiting it. One of the other things that the state has said is they understand that there need to be some community level events, things like trunk or treats or haunted XYZ. And for those, make sure that your group limits are low. So in other words, your event guidance still applies for Halloween, and that your socially distancing groups, you're making sure that there's no situation where there could be bunching either at the entrance to an event or in the middle of an event. Just, you know, pretty similar to what's already been said for every sector, but just recognizing that obviously there are going to be a lot of people who want to do more. So just be cautious about that. And I think, Corinne, you shared the Halloween guidance, I think last week, and we'll do that again. It's available on our website. It's available on the state's website as well.
Sanitize your kids' candy when it comes in, you know.
Yes. Masks.
Yes,
really,
the masks.
Halloween masks are not COVID-19 masks. Your kids need to be wearing both. If they're going to wear a mask for Halloween, they need to be wearing a COVID-19 mask. My wife is not excited about me going as a person living through COVID-19. So I'm just going to wear a mask and look normal. That's my plan.
Yeah, I got my kid a costume this year that didn't have a mask, so I didn't feel worried about suffocation issues. He'll just be wearing a black mask. So,
yep.
And I know that my community put out a Facebook notice that said, put your light on if you're participating, don't put it on if you're not, wear a mask if you're participating, if you're not, turn off your lights. So I think that, you know, social distance, wear a mask, sanitize, you know, clean. We're just keeping in mind that. And then the last PSA that we've been saying is get your flu shot. It's flu season again. And in between these sessions, remember, next week, 3 o'clock, we have these sessions. Anybody that's new to these sessions, just go to boulderchamber.com every week, 3 o'clock. You can ask questions in between. You can send them to me, or you could go to the email address that Jesse had up. And in between the weeks, or you could join the sessions and ask them.
Try and get
that slide up us one more time. It's like the last of 40 slides, so it might be hard to get to. But we want to, again, thank everybody for joining us. It was part of the Boulder Economic Summit, but it was a good way for everybody to see that this is a regular way for you to get your public health updates as businesses, to ask your questions, to make sure you're navigating this ever-changing world of public health orders, and so that we're reopening in a safe manner so we can keep our economy open and so that we can stay safe and healthy as a community, as the Boulder County community. Until next week, thank you, Lane and Jesse, and thank you everybody for participating, and we'll see you next week.
Thanks, everybody.
Good job, Jesse.
Thanks. Bye, everybody. Thank you, Lane.